Health Cabinet Secretary Aden Duale now says some Ministry of Health officials could be complicit in organ trafficking syndicate in the country. Well, this comes as the National Assembly Health Committee launched an 80-day probe into what could unravel one of the most disturbing medical scandals in Kenya's history. Allegations of an organ trafficking syndicate tied to Medihill Hospital. NTV's Laban Shaban reports.
It is now emerging that senior officials in the Ministry of Health have been enablers in the organ trafficking syndicate in the country.
We must get rid of cartels. Health
Cabinet Secretary Aden Duale has questioned how foreign doctors banned from practicing in countries like India continue to be licensed in Kenya.
We must clean the health sector. Where was the leadership when somebody was doing organ trafficking in Eldoret? I mean, the leadership was there. Am I right? Minister of Health not started yesterday. KMPD was there when the organ trafficking was taking place.
This comes as investigations into Medihill Hospital in Eldoret reveal suspected ties to a global organ trafficking ring where organs are sourced from vulnerable individuals and sold to wealthy foreigners.
Poor Kenyans, because they are very poor. Somebody comes and says, I'll give you 500,000, then he removes his kidney. That is very immoral.
Aside from Duale probe team, the National Assembly Health Committee has instituted another inquiry chaired by Seme MP Dr. James Nyikal.
And we want to say this is an extremely important issue in the country in regard to the issue of organ transplants, which is an important part of healthcare.
The move follows mounting public concern and a recent expose implicating the hospital in possible breaches of professional ethics, transplant tourism, and the commercialization of organ donations.
The process that we have started is what will give us information on how widespread it is, or whether it is just confined to the Medihill group of facilities or just the Eldoret Medihill facility only.
Among the key focus areas of the inquiry will be the role of foreign nationals allegedly linked to transnational organ trade and whether Kenya's regulatory framework was followed or ignored.
And to identify if there are any gaps in our systems that can lead to this happening.
The National Assembly Health Committee has 80 days to table its findings. Meanwhile, Medihill Hospital has broken its silence days after its founder Swarup Mishra was suspended from a state job. Medihill legal representative Conrad Maloba says the facility is fully committed to the ongoing government audit exercise defending its operations.
We're clean, our processes are clean. We have all the records to confirm that our processes are clean, and we'll have an opportunity to interview our doctors tomorrow, specialist doctors and administrators, and we believe that at the conclusion of the audit, we'll get a clean bill of health.
As parallel investigations unfold over the next 80 days, all eyes remain on Medihill Hospital and the regulatory bodies tasked with oversight. The findings of this inquiry could reshape the future of organ transplant in the country. But now, the nation awaits answers. Laban Shaban, NTV, Nairobi.